Okay, welcome back. In this video I want to talk a little bit about my bonding process, the protocol that I use when I'm bonding in a restoration of just about any type. Here is our tub that we like to use. It's got pretty much everything. I hope it has everything that I need and that I use for bonding. I'm going to walk you through my process of bonding. Generally, as I mentioned in the previous video, what we're using to bond, we're bonding primarily one of these two materials or composite resin. I do bond zirconia essentially the same way, with one exception, and I might explain that a little bit. So after the restoration is prepared, tried in and adjusted as needed, I always micro etch with 50 micron aluminum oxide particles the intaglio surface of the crown, or the inlay, or the onlay. Micro etch that with aluminum oxide. Alcohol it off, make sure it's clean and clear, and then there are kind of two things to consider. Number one, we have to treat the ceramic, the restoration. And number two, we have to treat and prepare the tooth. So let's talk about treating the ceramic first. So for the ceramic, I use an Ivoclar product called Monobond Etch and Prime. Focus, there we go. This does your hydrofluoric acid etch and silane coupling agent at the same time. This prepares the ceramic for the bonding process. This is a very simple material to use. Usually we take a micro brush, dip it on the top, fill up the brush tip of the micro brush, and scrub only the intaglio surface of the restoration with Monobond Etch and Prime. You have to scrub it. The instructions call for a 20-second active scrub, so you're actually scrubbing the surface for 20 seconds, and then you let it sit for another 40 seconds. That allows the chemistry to complete its reaction. At that point, you rinse it and dry it, and then you set the restoration aside. Now, let me remind you again that this step with the etch and prime doesn't happen until after you've tried in and adjusted the crown or the inlay or the onlay or the veneer or the bridge. This is the final step in preparation for the restoration. So now we've used one material as opposed to using yellow etch, which I don't even think I have in here anymore, or red etch, and a silane coupling agent. This one material has it all in there. Takes 1 minute, right? Rinse it, dry it, make sure you don't get on your fingers, make sure you're not getting it on the patient anywhere, so it has to be totally easily controlled, okay? The second pathway, so we've prepared the ceramic, the second thing we have to do is prepare the tooth. So I like to use a selective etch. This is 37% phosphoric acid, that's upside down, etch gel. I like to use the kind of the runnier type. They come in different, versions. This is the pulp tint version. 37% phosphoric acid. Selective etch, normally I'll selectively etch the enamel. So I'll hit all the enamel surfaces and then I'll squirt it all over the dentin and rinse it off real quick. So the enamel maybe gets 30 seconds of etching. The dentin gets maybe 10 or 15 seconds. I don't want to over etch the dentin. It tends to be really, 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 really sensitive. So etch, rinse and dry, but not over dry. Don't over dry. Next on the tooth, I like to use Gluma. My experience is if I use Gluma after the etching step and then a quick rinse and dry, yes, we rinse Gluma, then the sensitivity level is much, much, much lower. And there are also studies that show using this chemical actually helps to increase your bond strength. So, quick etch, selective etch, Gluma, rinse and dry. And this I scrub for 20 seconds and then rinse and dry. But again, don't over dry. We don't want to collapse the dentin tubules. So at that point now, the tooth is ready to be bonded. And my bonding that I use is Adhese Universal. And the reason I use Adhese Universal is I love it, and it pairs well with Variolink Esthetic. Okay, so I bond it with this. This goes on the tooth after the Gluma is rinsed and dried off. There's a little tip that'll go on there, like so. You'll click it 2 or 3 times. Usually 1 click per indication after that, 2 or 3 to prime it, and then you're scrubbing. And this is a 20-second scrub, active scrubbing, kind of like the scrubbing with the Monobond Etch and Prime. You have to be actually scrubbing the tooth for 20 seconds, right? Scrub, scrub, scrub. After that, you air dry it. Now, here's a critical piece of the puzzle. Anytime you hit the air button alone, if you're holding it next to a paper towel, you will always get a little blast of water out of just the air side, at least in my practice. So you've got to get all the water out of the air side before you air dry the tooth. The challenge that we have sometimes is we think we're using dry air, but we're actually using a blast of water and then dry air, which just decimates your bond strength. And in my experience is oftentimes the number one cause of a crown or an inlay or an onlay or veneer or bridge debonding. So I usually take my air water tip, push only the air button, and I put it on a napkin or on the paper liner on the tray, and I rock it around a little bit. I've got another video somewhere that shows that. And I get 2 or 3 blasts of water out of just the air. Once there's no more water coming out of there, then I take it to the tooth, which has been isolated, usually with cotton rolls and the assistant sitting there holding everything away, and dry the tooth. Now the instructions with the Adhese Universal when you're drying is you have to dry until things stop moving. That's not just 1 second. Sometimes it takes 10 or 15 or 20 seconds of drying if you've got a lot of bond on there. You've got to dry it until you completely thin out the carrier so that it's stable now on the tooth. And then you light cure it. We use a Velo. I don't have a light in here. A 5-second power cure. As soon as the assistant hands me the curing light for the cure after I put on the Adhese Universal, she begins to now load the crown with the cement. So Variolink Esthetic is my favorite, and the reason I love this cement is because it's got a long gel phase. Let me repeat that. It has a long gel phase, okay? Very long, which makes it really easy to clean up. So the process for using Variolink Esthetic, after I've light cured the resin, the Adhese Universal, right? Fill the crown, usually about halfway, make sure that all the edges of the crown are filled. The crown goes on the tooth. All the excess comes out of the outside of the tooth. I usually take my cotton pliers and I push down right on the top of the crown, and I tell the patient I'm going to shake on purpose. Sometimes they get a little chuckle, and I shake the crown. We know that all these cements, whatever kind of cement you're using, is thixotropic. It behaves like a non-Newtonian liquid. Just like tomato ketchup, it flows under vibration, just like your stone when you're pouring models. It flows when things are vibrating. So I'll push down and shake. Sometimes I'll get it to shift a little more, but I feel better about shaking. Then I take that curing light. All the excess is still sitting around the tooth, all of that excess. Put the curing light down on the occlusal, and I'm pushing down, or up, whichever direction. Pushing down, and I light cure for 5 seconds without moving. Right? 4, 5. And then I click the button again. I go 1 second, 1 second, 1 second, 1 second, and 1 second. And at that point, I take my Montana Jack curvature, and I'm pushing down and out. And then down and out. And then on the other side, down and out, down and out. So essentially, I'm wrapping the tine of that Montana Jack into the interproximal space and then pulling that cement out. Usually I'll get 2 big pieces that come out like that. Right? 2 big pieces of cement. At that point, I'll scout around with the Montana Jack a little more to make sure there's no extra. I will floss, so I pop it down. I'll roll the floss over and pull it out the side. Go down to the other side, pop it down, roll the floss over, go out the other side, and then I light cure it the rest of the way. Usually, if I do it in that manner, after that, I real aggressively floss to make sure there's no extra cement. Generally, the cleanup is very, very fast. So for me, that's really the whole process that I use. At that point, you can check the bite and stuff. I never check the bite before a crown is bonded in. Let me show you all the chemistry that I'm using. It's all right here. I love Variolink Esthetic. I've been using it for a couple of years. There it is, all of it. Variolink Esthetic, Adhese Universal. And I should mention that Variolink Esthetic comes in different flavors. Neutral, warm, light, and light plus, I think. I don't remember exactly. Neutral tends to have a little more gray tone, a little colder. The warm, of course, is a little yellower, so that can brighten things up a little bit. We do have the try-in paste that goes with these as well. But for me, a big game changer has been this material, this Gluma, which helps to decrease sensitivity, which you use after the etch step, and there's a quick rinse and dry, but don't over dry. Okay, that's my bonding protocol. Generally speaking, if I am unassisted and have a single posterior crown to bond in, from trying an adjustment of the crown to having the dental assistant take an x-ray and walk the patient out, usually you can have the crown cemented in less than 5 minutes and cleaned up. Usually. Now, if it's an isolation challenge, if there's difficulty there, that's something that you'll want to watch out and be cautious of. But generally speaking, this process has worked really, really well for me. I would encourage you to add retention grooves. interproximal and buccolingual. Interproximal for single restorations, buccolingual for multi-unit, bridges. Any mechanical retention we can give our restorations will increase bond strength and retention, and you'll have less frustrated patients over time with potential debonds. But generally, if you get good moisture control and you follow all the steps and the protocols, things work really well. So hopefully that's been helpful. I get a lot of questions about my bonding protocol. Maybe I'll try to put together a video that actually has me demonstrating that on a typodont or something. Anyway, thanks for watching. Please let me know what other questions you have. Enjoy!